Imagine this: you're out for a walk, minding your own business, and suddenly you sneeze. You think, just allergies, right, but then you pause. You've heard a lot about this thing called coronavirus, this invisible threat that's completely changed the way we live, work, and even breathe. The problem? You know about it, but do you really know what coronavirus is and why it's so different from other illnesses? What is coronavirus? Let's break it down. Coronavirus isn't just one thing, it's actually a huge family of viruses. Think of it like a family tree with many different branches. Some branches have been around for a while and cause things like the common cold. But in 2019, scientists found a new branch on this tree, SARS-CoV-2. This particular coronavirus, the one that causes COVID-19, took the world by storm. It wasn't like the others. Why do they call it coronavirus? Well, the name comes from Latin, coronum, which means crown. These viruses have crown-like spikes on their surface, so that's how they got their name. Picture a little spiky ball, almost like a miniature sea urchin, but with the power to impact millions of lives. COVID-19 and SARS-CoV-2. Here's where it gets more specific. SARS-CoV-2 is the virus, but COVID-19 is the disease it causes. COVID-19 stands for Coronavirus Disease 2019, since it first emerged in 2019. The World Health Organization officially named it in early 2020, just as countries around the globe began seeing cases. And it's not like other coronaviruses that humans have encountered before. SARS-CoV-2 spreads more easily from person to person than the SARS virus that led to a smaller outbreak back in 2003. That's part of what makes it so dangerous. It's not just that it can make you sick, but it can spread like wildfire without you even realizing it. How it spreads. You've probably heard this part 1,000 times: COVID-19 spreads through tiny droplets. But here's the thing, it's not just coughing or sneezing that spreads those droplets. Even when you talk, those droplets enter the air, hanging around long enough for someone else to inhale them. Imagine walking through an invisible cloud of germs. It's not something you can see or dodge. And while COVID-19 and the flu might seem similar, they're actually caused by completely different viruses. Think of them like distant cousins with similar symptoms, but very different impacts. Both can cause fever, fatigue, and breathing issues, but COVID-19 can spread faster, last longer, and affect your body in ways the flu doesn't. Why COVID-19 is serious. So, why the fuss? Why do we need to be so careful? It's because COVID-19 can hit certain people much harder than others. If you're older or have health issues like diabetes, your risk for serious complications is higher. The disease doesn't just impact your lungs, it can affect almost every system in your body. There's another layer to this: people can carry and spread the virus without even knowing it. That's why prevention is key, and why we all need to stay cautious, even if we're feeling fine. Preventing the spread, what you can do. Now that we've covered what COVID-19 is, let's talk about how you can keep yourself and others safe. First, there's physical distancing, something you're probably familiar with by now. This means staying 6 feet away from others when you're out and about. Imagine holding a broomstick between you and the next person. That's roughly the distance to keep. Then, there's hand washing. Our hands are like sponges, picking up everything we touch. So, wash them often. Use soap and water for at least 20 seconds. A quick rinse isn't enough. You want to make sure those germs are really gone. No soap and water? Use a hand sanitizer with at least 60% alcohol to get the job done. Another major step: avoid touching your face. Think about how often you touch your phone, a doorknob, or a public surface. All of those are spots where the virus can linger, waiting for you to touch your face, nose, or eyes. The importance of masks. Wearing a mask is like adding an extra layer of protection. You want it to cover both your nose and your mouth, fitting snugly without gaps. When you wear a mask, you're helping to keep those invisible droplets from spreading if you cough, sneeze, or talk. And don't forget to wash your masks regularly. If you're using a cloth mask, It should be washed in hot water after each use. Disposable masks? Those are just that, disposable. Use them once, then throw them away. Cleaning and disinfecting surfaces. Next, let's talk about surfaces. The virus can linger on places like doorknobs, tables, and countertops. Regularly clean and disinfect these high-touch areas. All you need is a household disinfectant, or a simple bleach solution. Picture this: each time you clean a surface, you're erasing a potential threat, making it safer for everyone in your home. Watching for symptoms. Symptoms can vary from mild to severe. Most people will experience things like fever, cough, and shortness of breath. But here's the tricky part: not everyone will have the same symptoms, or even any symptoms at all. So, it's important to monitor how you're feeling. If you do feel off, take your temperature and stay home if possible. If things get more serious, say you're experiencing difficulty breathing or persistent chest pain, don't hesitate. Seek medical help right away. And remember, when calling for emergency help, let them know about your symptoms so they can take precautions. Taking care of yourself and others. If you're feeling sick, staying home is crucial. Isolate yourself from others, even in your own home, if possible. The last thing you want is to risk spreading it to family members, friends, or even pets. And if someone else in your household is sick, wear disposable gloves when cleaning, and follow all the hygiene steps we've covered so far. Every bit of caution helps. Conclusion. In the end, the virus that causes COVID may 19th be called coronavirus, but it's different from others we've encountered. It's here, and it's part of our lives now, whether we like it or not. But by understanding what it is, how it spreads, and what we can do to protect ourselves, we can reduce the risk of transmission and protect those most vulnerable. We all have a role to play in this. Imagine if every small step you take, wearing a mask, washing your hands, keeping your distance, helps to create a safer world for everyone. We've come a long way in understanding this virus, and now it's up to us to stay vigilant, informed, and proactive. So, let's face this together, with knowledge and caution, one step at a time.